Welcome to Roadmap to Residency Evidence-Based Application. This is a video on healthcare policy and ethics. So, this is a basic outline of policy development. First of all, you need to identify a problem, and that is called as problem identification. And then you need to make a policy, that is called as policy formulation. And then you need to implement the policy in the public health, and that is called as policy implementation. And then once you have implemented the policy on the public health, then you need to evaluate if our policy is right or wrong. If not, then we again need to identify the problem. So this is a basic cycle of policy development. So a 45-year-old patient is admitted to the hospital for elective surgery. During the preoperative evaluation, the patient expresses concerns about the rights and responsibilities as a healthcare recipient. Which of the following statement best reflects the principle of patient rights? Patients have the right to dictate the treatment plan regardless of medical advice. Patients have the right to access their medical records only after discharge. Patients have the right to receive information about the diagnosis, treatment options, and prognosis. Patients have the right to refuse treatment, but healthcare providers can override the decision. Patients have the right to confidentiality, but healthcare providers may share information without consent in emergencies. So the answer is C. So option C best reflects the principle of patient rights. Now let's discuss what are the different patient rights. So this is from American Medical Association. So these are the different patient rights: to courtesy, respect, dignity, and timely responsive attention to his or her needs, to receive information from the physicians, and to have opportunity to discuss the benefits, risk, and cost of appropriate treatment alternative, including the risk, benefits, and cost of foregoing treatment, to ask questions about the health status or recommended treatment when they do not fully understand what has been described, and to have their questions answered, to make decisions about the care the physician recommends, and to have those decisions respected. A patient who has decision-making capacity may accept or refuse any recommended medical intervention. To have the physician and other staff respect the patient's privacy and confidentiality, to obtain copies or summaries of their medical record, to obtain a second opinion, to advise of any conflicts of interest the physician may have in respect to their care, and to continuity of care. So 45-year-old patient is scheduled to undergo a surgical procedure to remove a benign tumor. During the preoperative discussion, the surgeon explains the nature of the procedure, potential risks and benefits, and alternative treatment option. The patient expresses understanding of the information provided and agrees to proceed with the surgery. Which of the following ethical principle is most closely associated with this process? Beneficence, non-maleficence, autonomy, justice, or veracity? So autonomy. Autonomy is most closely associated with the process of described in the scenario. Informed consent is a fundamental component of respecting patient autonomy, allowing individuals to make decisions about their own medical care based on adequate information and without coercion. By providing the patient with information about the procedure, risks, benefits, and alternatives, the surgeons respect the patient's autonomy by allowing them to make an informed decision about their treatment. Our country's healthcare system undergoes significant reform aimed at improving access to care, controlling costs, and enhancing quality. Which of the following strategies is most likely to be component of healthcare reform efforts? Privatizing healthcare services to increase competition among providers, implementing universal healthcare coverage to ensure access for all citizens, limiting government regulations to allow for more flexibility in healthcare delivery, reducing funding for public health programs to prioritize acute care services, allowing insurance companies to deny coverage based on pre-existing conditions. So implementing universal healthcare coverage to ensure access for all citizens. So universal healthcare coverage seeks to ensure that all citizens have access to essential healthcare services without facing financial barriers. This approach aligns with the goals of healthcare reform, which often include increasing coverage, improving healthcare outcomes, and promoting health equity. And that concludes our video on healthcare policy and ethics. Thank you for watching.